Hi friends, this is PLAB 2NHS team and today we will be seeing how to approach a telephone station. Let's start.
So why is a telephone station a little challenging is what we will discuss first.
Earlier we used to have
Telephone conversation, but still the patient used to be in front of us in the cubicle. Post-COVID, no one is there in the cubicle. You are alone having a question in the cubicle. Maybe you will be having a discharge summary. Maybe you will having a photograph, an X-ray, an ECG, could be anything kept in the cubicle. How it becomes more challenging is when you introduce yourself in telephonic station, you basically have a lot of things to deal with before you even start asking, how can I help you? Okay, we'll go through it, obviously. Apart from that, in case if you have any other paper which is kept inside the cubicle, for let's suppose if you have a X-ray, whether you have a discharge summary, whether you have a big question which you probably couldn't read through well outside the cubicle because you didn't have much enough time and you were processing what has to be spoken in the cubicle. Sometimes it becomes difficult to process because when the question is from, let's suppose, ethics or counseling, the questions are very big and it's very difficult to process all of them together and keep all the information in mind once you enter the station. So it becomes fairly difficult in terms of time management here because you basically do not have any physical, verbal or non-verbal cues, to be honest. You have to completely rely on your senses. The modulation of the voice from the patient, or if the patient himself or herself voiced their concerns completely. Another important thing is you will not have much of the things to deal with in the management section. So we have to be very clever when we are dealing with the management, because when you are speaking to someone virtually, obviously you cannot see them. There are no verbal cues. You cannot do any investigations at that moment of time when you're speaking to the patients. But there are very little things that you can tell him or her or ask them to come down to the clinic or to the hospital. We'll see all of those. So telephone stations becomes a little challenging.
It's possible that GMC might surprise you by giving you paper inside the cubicle, which might contain a lot of information in a very small amount of time to process in. And you would have to speak to the patient and then also have to look through the notes. So it completely depends how you want to
proceed. Either you can go inside, introduce yourself, tell the patient that could you give me a second please so that I can go through my notes. That's one way of doing it. Or if you are really good in multitasking, to be honest, what you can do is while you are speaking or introducing yourself, that comes as a reflex for everyone. You don't really have to ask the patient for some time for you to go through the notes or the entire chart that was given in the paper. So what you can do is while you are speaking the introduction, the starting introduction period, you can quickly go through, or as you are talking to the patient, you can go through. It is very easy said than done. I can be very, you can be very reassured about that. It's not that easy to do two things at the same time, because if you miss any clue from the patient, you will not be able to address their concerns in the management part. So it's a bit challenging, but we'll see how we can probably tackle them. We'll do a few case scenarios as well, and we'll see how we can do it much better in the exam scenarios. Okay, so let's get cracking and start the session today. So few things what we have to understand is what are the key considerations when we are looking into a telephonic consultation. Okay, so the first thing that you have to keep in mind is that the emphasis should be to obtain as much as information as possible. The same reason as I told, you do not have any clues as anything ever over here when you're talking to a patient virtually over a telephone. So you've got to make sure that you collect as much as information so that you can reach a differential diagnosis in your mind and also can give a perfect safety netting and can do the management as required per the station. So because as I said, management is not quite a lot on a telephone consultation until and unless it's a counseling station. We will see how it goes. Okay. The next thing is you have to make sure, is it the same person that you are talking to the patient? Let's suppose the name of the patient given in the station is George George Matthews or George Michael, any name is given, you have to make sure you're talking to the same patient. So it's very important that you know that you're talking to the same patient and you're not talking to any of the family members or any imposters, or you are not giving a false information or breaking any confidentiality, even unknowingly. So we have to be very careful in a telephone conversation. Next, if you have called them or if you have phoned them, you have to be sure about that whether they are in a suitable place to receive a telephone call. For example, they might be driving, they might be in a meeting, they might be in their office, and that might not be a suitable time or a suitable place for them to hear whatever news you're going to give them. So let's suppose if you're going to give them a breaking bad news, that's not a good scenario, right? And that's not a good place that you want your patient to be. So that becomes very important when you have called them. Obviously, when they have called you, it not might be of much importance where they are, because if they have called you, they must be in a good place, because that's the reason they have called you, unless and until it's an emergency maybe. Next thing to keep in mind is to obtain a permission to conduct a telephone consultation. Is that okay with you if I discuss few things or your medical things about yourself today? Is it okay if I can talk a little bit about your health today over the telephone? It's very important. What if they do not want to discuss it over a telephone and maybe they want to come over and maybe discuss? That could be one of the scenarios, right? So it's very important that you take a permission before you even start discussing anything about the station. Okay. Next thing. Always remember, in this telephonic conversation, eyes becomes much more important than any other scenarios that you will come across in your station. Obviously, not saying that it's not important in other scenarios or cases, but here in the telephone consultation it becomes much more important. Okay, especially the concerns and the expectations, because they might have a lot of concerns and they might be expecting you, doctor, do you think I can come in today itself to see you? Or, doctor, do you think I need a CT scan? Or, doctor, do you think I should be getting admitted today? Or do you think I should call someone and call the ambulance and come to the hospital? Could be any number of expectations that they want you from. Maybe they might ask you, doctor, can I get a prescription for so and so drug? So here it becomes very much important, because that will form your management. Because as I said, management is not quite a lot. I'm reiterating it. It's not quite a lot in scenarios of telephone conversation or consultation. So your eyes becomes the part of your management, and whenever you have a concern and you are addressing it, and whenever you have any expectation again, and when you are doing it, and you are letting them know that you will be doing their expectations as whatever they want. Maybe you might not be able to do what they are expecting you to do over a telephone. So whenever you answer or address all those concerns and expectations, you basically are doing your management over a telephone. The next thing is, could the patient be depressed or anxious? Yes, they can be. So that will depend upon the way they are talking. That will depend upon if they are taking a lot of time to open up to you, or if they are taking a lot of time to answer your questions. They are a bit reluctant in answering your questions. It could be a depression. It could be they are very anxious about their back pain, chest pain, having, let's suppose they're thinking that they might be having myocardial infarction, they're having any cancer. They might be anxious about a lot of different things. And this could easily be missed in the absence of any visual cues, because we do not have it, and you are not preferred to see someone in person. So it's very important that we take a good history because of this scenario, and we have to ask eyes, which is very, very important, as I mentioned, so that we can understand what is going on with them and give them the best management plan. It could be coming to the A&E immediately, could be going to the GP and having a visit immediately, could be a very important referral, urgent referral, could be anything. So it depends upon scenarios to scenarios. Okay. Next thing. What is the patient wanting from the telephone consultation? So as we have discussed about any expectations, which is very, very important to know in the scenarios. Okay, so what do they want from you from a telephone conversation? Why have they called you urgently over a telephone?
Okay, does the patient need to come in for a face-to-face consultation? Most of the scenarios we have to tell the patients that you need to come to the GP clinic, you need to come to the A&E, you need to come to the hospital so that we can further assess you, which is very, very important. Whenever you say this thing that you have to come to the hospital, you have to come to the GP clinic, the next question that the patient will throw at you will be, doctor, when do you think I can come? And obviously never say today, tomorrow, next week, because if it is given in the question, obviously use that as your template and answer the question. But if it is not given in the scenario that when there is a slot opening where you have to know whether you have the appointment available or not available, do not go over the board and answer any of the questions which you do not know, because that will be a false answer, because you yourself don't know when you will be able to put in with an appointment with your GP, with a consultant, or with your reg. So it's very important that you always tell the patient that I'm going to look up or going to speak to my seniors and see when the consultation is free. And what if I give you a call? How does that sound to you? Confirming the date of your consultation. So whenever you throw in a question, always ask, how is that for themselves? Are they okay with whatever you have put forward as a management plan? If they say yes, go for it. If they say no, give them another option if you are having available. If you don't, tell the patient that that's all right, Mr. Smith. Let's suppose Mr. Smith, that's all right, Mr. Smith. What I'm going to do right now is I'm going to speak to my seniors and get back to you. Again, how does that sound to you? Is that all right with you? So asking a question, giving a to and fro answers, just like a conversation, is very, very important, because in a telephone conversation, you cannot see their face, whether they are angry, whether they are mum, whether they do not want you to speak, because you will keep on going speaking for a pretty long time and you won't even realize, to be honest, because nobody is there in front of you so that you can see their face and say, okay, he or she is not understanding, I should just stop. So you can't do that. There is a lot of time it happens that you will go over the board and keep speaking for great lengths, which is absolutely not the right way. Okay. Now, if the patient does not need, so again, if they are coming to see you, let's suppose if they're having severe back pain, they're having severe chest pain, do you think you should ask them, can you drive and come? No, right? So there where your presence of mind clicks, if you say, that do not worry, we'll be sending you an ambulance, I have already called them, but by the time ambulance reaches you, let's keep talking over the phone. Do not cut the call. What if you cut the call and the patient goes into a cardiac arrest? Could be happening, anything could happen. So your presence of mind becomes very important. You can tell him, there are scenarios where I'll give examples later on. So in scenarios like this, you can tell, do not worry, I have called in the ambulance, they will reach you as soon as possible. By the time they reach you, what if we just have a little conversation and keep going on? So that makes it much more easier for them, so that you are still on the call and you yourself become a safe doctor, so that you're not letting the patient be on themselves. Okay. So it becomes very important. And what if the patient they do not need to come and see you? How can they have enough support at home, which is very, very important to know? Social support. Do they have anybody at home? What if they are alone? Can you arrange a carer for them? Can you ask them to come to the hospital so that you can be there for them? And then you can probably call social services, or you can call nursing homes, or you can call a hospice in cases of if they are in a very critical situations and you cannot do anything in a medical intervention. So everything comes in handy when you have a lot of things in your mind and you are going with the right approach. Enough support at home. Let's suppose if the patient does not need to come in to see you, and you are thinking, what if I can ask him for a medical test? He cannot come in. What can you do? Can you arrange a phlebotomist to go? Yes, you can do that. Can you ask him that if he can come to his nearby surgery where he can give the blood so that we can collect the reports from there? Yes, that's a very good option that you can give him. So all these presence of mind will work. Give them the most simplest solution you can. Don't give them complicated solutions. Patient needs solutions which can be dealt immediately. They don't need solutions which can be dealt for far long sight, which is very, very important. All right. I hope I'm clear till now. Do you guys have any questions till now? Anyone has any questions till now? No? Okay. Right. So let's proceed then.
Sorry, Dr. Shan, I have to ask regarding the example you just gave for the blood samples. There is a scenario in which there is a missing blood sample for the pre-op assessment.
Yeah.
In which scenario can we give the option of sending phlebotomist or referring to the GP?
First, always see, sending phlebotomist should be your last option. First, asking him to come to the hospital should be your first criteria. If he cannot, or if he tells till the end that he cannot come in, then you can tell that is it okay that if you can go to a nearby GP where you can give your bloods and probably we can collect it from there. Most of the times it will not reach there, but it is always good to have your options open, because whatever scenarios you read, it's not necessary that you will be having the same scenarios in the examination. They have variations of scenarios available for each and every station that you think you are reading from the scripts. Let it be any scripts for that matter. They have variety of variations, and trust me, they have. And as I have mentioned before as well, one of the most famous pep talk that you will receive in the GMC when you go for your examination will be, do not, the chief examiner who will generally come, she will give a pep talk, and that's a really good thing basically, so that you are aware. She will say that do not go through the station which is there in your mind, go through the station which is there in the question paper, because they know that most of us, we go through the academies, we have learned stuffs, we know the scenarios, and that's one of the reasons why they keep bringing up new stations. Basically, they are not new stations, they are just the medical stations which any FY2 rotation junior doctor generally sees in the ward. And it's just a variation of that. And since we are very much, and we try to not to be scripted, but whenever we see a diabetic scenario, everybody knows so well that we generally go with the station which is there in our mind, and we forget to pick up some clues probably which they would have changed in the station. That is why you might have heard few people, even with the most simplest scenarios like ECG teaching, people get 0 in data gathering, people get 0 in management, and it's very difficult to get 0 in something. Trust me, you cannot get 0 in one of the particular station until unless you have missed a very important clue which the patient would have given you, or you would have been very scripted. So it's not that easy to score 0 as well. Okay, so that's very important to know.
Yeah,
Okay.
but the task is only saying just convince the patient to come to the hospital. So I have to stick with the task, or I can give the option.
If the task says that you have to convince, which I'm very sure the task will not say to convince the patient to come to the hospital, the task will tell you, ask the patient, the task will tell you, talk to the patient, assess the patient, and ask him to come to the hospital to give. But what if in the scenario, if he doesn't agree, will you just tell him or keep consoling him and will not finish the station? That's not an ideal situation. If you
Yeah,
convinced
that's
him once, twice, thrice, and you know that you cannot convince him anymore, give him another option. Maybe he's looking for another option. That is the whole situation is about. As I have told, if the patient, when we do this role play, if I keep telling one thing again and again, that means I need the solution immediately. Even though you have told me in the beginning, let me ask a few questions, and if I get to the bottom of it, I will tell you whether it's cancer or not. Maybe if I bring it up again, maybe I want you to ask me questions on cancer, or maybe I want you to address that concern immediately. That's the reason I brought it again. So that happens. So if you know that you cannot convince the patient once, twice, thrice, you have to give him another option. Okay.
thank you, Dr.
No,
Shan. One more question.
yes.
Like in telephone conversation, if we are going to break the bad news, and like as a protocol, we used to ask, do you want somebody to be with you? So
Yeah.
how we can offer in telephonic conversation?
We'll go about it. We'll go about it. Okay.
Thank you so much.
No problem. Now, when it comes to data gathering over a telephone station, as I have told you, it's one of the most important part. Since we are not in front of the patients are not in front of us, we cannot see any non-verbal cues, which is actually sometimes very, very important in the stations. So we have to realize and familiarize ourselves with any relevant clinical details which is given in the question. It might be outside your cubicle, or it might be present inside the cubicle in the form of a discharge paper, in the form of number of medications the patient is taking, in the form of an X-ray, an ECG, a dermatological picture. Could be anything, to be honest. Okay, so when you introduce yourself, hello, my name is so and so, an FY2 or SHO from XYZ medical center or XYZ hospital or a GP clinic. I understand you wanted to speak to a doctor today. Obviously, they have not called to speak to you until and unless the question tells that the patient has called to speak to you because you kind of examined him today. So until unless the question tells you that, you have to say that I understand that you wanted to speak to a doctor today. Are you okay to talk with me now? So when you say that statement, you are basically considering whether the patient is in a safe environment or whether the patient is not in a safe environment to speak to you. That becomes very important here. Whenever you have to, then again, obviously you have to confirm the patient's identity, because you have to understand whether you are speaking to the same patient as given in the question, or you are speaking to someone else. Although it has never happened till now, but it may happen, so it's always better to confirm a patient's identity. So before we proceed, could you please confirm your name and age? Most of the times here in the clinic, in the hospitals, they generally confirm a date of birth, but in the examination, date of birth is not given, because if they tell you date of birth, most of the times we start calculating what is their age so that we can fix some diagnosis according to that. So here they do not give in the station any date of birth, but if you ask date of birth in the telephone station, it will be there in the paper. Okay, so here in the paper there will be details of the patient, the name, the address, and the telephone number, maybe the date of birth, whatever is given in the paper inside the cubicle as patient details. Everything needs to be verified. You cannot skip anything thinking that, oh, I might not have time. You have to verify. That's the reason they have given you in the paper. Otherwise, it doesn't make sense for them to give you in any paper in the cubicle. Okay, so have to verify everything which is given in the question paper. Now, once you have confirmed everything, you have identified yourself, who you are, what is your position, from where you are calling. You have also addressed that they had called you to speak to a doctor. That was the statement. You have also said whether they are in a good place to start the talk about their medical condition or not. You have confirmed the patient's identity, whatever was given in the question paper, and then your consultation starts. So when you do all of these things, a good 25 to 30 seconds, sometimes maybe more, depending upon whatever information is given in the paper, a good chunk of 25 to 30 seconds goes here. And the additional 5 to 6 seconds goes when you basically enter the station, sit yourself in the chair, and then say hello. Okay, so remember, whenever the GMC bell rings and they tell you enter the station, I suppose, right? When they start basically the bell starts, they say you enter the station. So as soon as the first music of the bell starts, your counter has already started. Your time counter has already started. So the entire bell rings, you knock, you enter, you walk, sit, say hello. A good 5-6 seconds have already gone. So I'll tell you what I used to do. I used to read the question. If I've read the question, I used to keep looking at the timer on either side of the screens, which is on the top side. And as soon as I see 1 and 2, 1 second, 2 seconds left, I used to be very prepared to knock the door. And as soon as the bell used to start, I knock the door, quickly go in, sit down, saving 1, 2, 3 seconds of my time. Okay, so any seconds of time saved in a telephonic station will be well cherished at the end of the station, because that will be very, very important. Okay, also, when you enter the station, as everybody, when you are practicing, I would say, whenever you enter a station, you have to do 2 things. You have to say your name out loud and also your GMC number. So you enter the station, stand there, tell your name, your GMC number, go in again, sit down, and again start introducing yourself. So you are basically introducing twice. Okay, you're introducing yourself twice. So everything takes time. So if I tell whole about a good chunk of 30 seconds, I would say, in and around, maybe 25, 30, you basically lose 30 to 35 seconds even in the beginning of the station before you, when you say, how can I help you? Okay. Now, the next thing about is when it comes to history. So as I've told, you have to take a very targeted and focused history, because you cannot go through all the differentials that you generally have in your scripts, which is not at all possible in a telephone station. We are already losing on time. So you cannot go through all the DDX. You have to be very specific, and you have to have your DDX with the opening question, Socrates or Odipara. Once you are done with the Socrates, once you are done with your Odipara or Odipara, you should be very well having 2 to 3 diagnoses at the minimum to go on with your focused history taking. Always, whenever you are taking a focused history, make sure that the order of preference of your differentials comes from the first thing which will kill the patient first. So ask questions on that, and then go on asking the least ones which will be killing the patients. Social history, as we have discussed, social important is social, because you have to have a social support, because they're calling over a telephone. Let's suppose a 62-year-old man has called you. You definitely have to ask him what is the social support. People can be calling in from a car, or you are calling them and they are in the car, and you are going to you are going to break a bad news to them. So you have to be very well aware where they are, especially the social history, where they are, whom they are with. Obviously, as the doctor asked before, saying that in that scenario, most of the times we ask patients that when we break a bad news, that is there anybody whom you can call? Obviously, you can't ask the same thing because you're already on a call with the patient. What you can ask him, is there anybody around you who is there along with you as we go forward? Maybe they might be in the office, or if they are not there in the office, if they're driving a car, initially you can ask them, could you park your car towards the side so that we can discuss? Is this a good time to speak to you? If they say yes, no, or whatever the response is, always ask them before breaking up bad news, is there somebody around who is there when we go forward with the consultation? They might say yes, they might say no. Depending upon the answer, your next reply can be. So social history becomes very, very important, okay? Because obviously they can't come to see face to face, neither you can keep them in the hospital, neither you go personally to see them immediately. Risk factors, very important. Most likely it becomes very, very important in such scenarios where you cannot have a visual cue. So you have to have a risk factor in your mind. You cannot skip risk factors in scenarios like this over a telephone. IPS obviously is very, very important. It starts the moment you introduce yourself, what you have checked in a telephone consultation, where they are, how they are, if you're talking to the same patient, every single detail will count towards your interpersonal skills. Okay, so eyes and their effect on daily life. Let's suppose if I say that I'm having this leg pain since past 2-3 days and I'm not able to go to work. So how has it affected your daily life? Becomes very important. And how could you establish a rapport? Your warm tone of voice, your modulation of voice, as we have discussed time and again, becomes very, very important. You have to be sensitive to the patient's mood, and obviously you do not have to be afraid to ask how they are feeling or if their symptoms are letting them down. Scenarios in this COVID period, you can use them as your advantage, can ask them, is the situations pulling their feelings down, or is the situation actually having an effect on their mood? Okay. You have to introduce eyes very early on in your consultation, especially in the telephone, so that you can use them very wisely in the management. The late you use, the less time you will have to think about what you can address or how you can address. So it becomes very important to use eyes very early in your consultation. As I said, since you are asking eyes, that is the time that you are allowing the patient to ask a question and voice the concerns. So when they voice their concerns, it becomes very, very important that you address them immediately, because you might not have another time in a telephone consultation to address. Okay.
Sometimes you might summarize, you might not summarize, depending upon what station it is. If it is a very small station, let's suppose if it is a pericarditis station and you know it is pericarditis, because the patient will tell you that when I'm leaning forward, the pain is basically becoming better, you know it is pericarditis, you can summarize very quickly, because you know that the management is not very big. They will not have much of a concern, maybe one or two concern if they are having MI, is it a heart attack, will I get better, if I don't get better, what should I do? So very simple questions they have, and you don't need to explain them because they will answer your questions. You will answer their questions very easily. So it becomes a little easier if you can summarize, because here obviously there is no time limit, but all the doctors and the GPs, they do tend to summarize clinical findings, whatever they have spoken, before they go on into the management. Okay, so you can do that. Additionally, you make sure that you have addressed all the patient's concern before you end the call, because then only the patient will be satisfied and the examiner will also be satisfied to give you enough scores. Okay, management. So when it comes to management, again, investigations, very big question, is it even possible? People have asked me time and again, how can we even voice the investigations in the telephone conversation? Now, of course, it's not possible to tell what investigation. Do not ever say that. You can do that. I have heard people saying that I would like to do so and so investigation, and either the patients remain quiet, or from the examiner they tell you, doctor, please proceed. So it's very impossible to do any investigation or any examination over a telephone. So even saying that and waiting for a reply from an examiner is actually a waste of time. Always start with the scenarios, just like we have discussed on the management part, Addison's, how it goes ahead. In the same way, for telephonic conversation, your first management should be how you are going to treat him, whether you are going to ask him to take over the counter pills for the pain medications, or if he is already taking, ask him to continue taking it, or you want him to come immediately to the GP clinic, to the A&E, to the hospital, whatever your situation is and wherever you are speaking from. Okay, so but it's very important that you tell that once you come into the A&E, these are the tests we will be doing to make sure we understand what is happening with you. And when we ask our senior or specialist to come and review you, they might be doing so and so tests. So in this way, you have made the patient aware what he or she will be expecting once they come to the clinic or once they come to the hospital. Additionally, you have also explained it to the examiner that this is the thing which is going on in your mind, and if the patient was there physically, you would have done so and so things. So both are happy. The simulator or the patient is also happy. The examiner is happy by your investigation and your management as well. Okay. Now, so management, how we should include? You have to start with the telephone advice, whatever you can give it over a telephone. If they are taking any medications, ask them to continue. If you feel so it is important, you can ask them to go through their online. Here you cannot provide them leaflets, so do not tell that I will give you leaflets. You cannot give them leaflets. So you should tell them some online information. You can tell them some websites. You can always refer them to the NHS website, which is very simple, and they know it because they browse it all the time. So you can tell them that you can always go to the nhs.net and you can find this more information there. You have to, that next thing, if it is very important, you can arrange a face-to-face assessment, maybe a home visit later on, but most of the times we don't do home visit right now, obviously because due to the COVID reasons. An urgent appointment with a GP or a routine appointment with a GP, maybe a nurse appointment with like a oncologist nurse or maybe a district nurse to go home and change the dressing for pain medications, anything else, or an urgent referral to the A&E, depending upon the scenario. Okay, most of the times in your station, if it's a medical station, always ask them, how about this, that when you come to can you come back to us so that we can assess you further, and when you come, we'll be doing so and so investigation, so and so test. Also, we will ask our seniors or specialists to come and review you so that we can get to the bottom of your problem. So it becomes as simple as possible, and your management becomes very small here because you're not telling him anything at all. Now, so let's suppose if you have a prescription and they tell you that, doctor, I cannot come here and I cannot collect the prescription.
Now there is an option that you can send in the prescription to the nearby pharmacy, or you can send into the nearby collection spot in the pharmacy, or to the GP from where they can collect a prescription. They don't have to come all the way to the hospital to collect a prescription. Okay. What if a patient has called demanding you some kinds of medication? Doctor, I need this medication. And let's suppose you examine completely and you said that, okay, I am in a good position now to give you the medication. And the patient says, I cannot come, doctor. What can you do now? So in risk of something, some very crucial risk factors, let's suppose Cauda equina, let's suppose MI. You're thinking the patient might have MI. Okay. You have to ask them to come urgently to the hospital, to the GP clinic, or you have to ask them to come to the A&E urgently. Now, depends upon, can they come in? Maybe you can't ask a stroke patient or a TIA patient or an MI patient whom you think they are having such grave conditions to ask them to drive and come in. So you ask them, is there anybody who can accompany you along with? If they say no, tell them that you will be sending in an ambulance, and by the time the ambulance reaches, let's continue the call. Don't finish the conversation. Ask them, let's continue the call. That will be a most brilliant IPS that you can throw in there, because you are well aware that you don't want to leave the patient alone. You know that nobody is there. They can't come themselves, and you are giving them additional support by being on the line till the ambulance reaches. Okay. Next, collecting a prescription. For example, if the patient has called you to ask for some prescription, like a demanding patient, and if they are asking you that doctor, I need so and so prescription, can you prescribe me? Or they say that doctor, I have been taking this medication, but now it's going to get over. Can you give me a prescription? You tell them, you assess them completely, take a good history, ask them about all the questions that you want to, and then you come to a conclusion that yes, it's safe to give him additional medications. Let it be painkiller, let it be anything else. And once you have done that, let's suppose the patient tells you that I can't come, doctor. Is there any other way possible that I can collect? And once that happens, you have a very important chance of telling him that it's okay if you cannot come in. Is it okay if you send over the prescription to the nearest GP clinic or to your GP clinic if there is someone nearby, and you can collect it from there? Then it's okay. If they say no, still there are pharmacy outlets who collect NHS prescriptions, and patients can go and collect from them as well. So there are varied options that they can do. These days, you also do an electronic prescription as well. So you send them over the electronic prescriptions where they can go and collect it. So it becomes fairly easy for them. Okay, so these, obviously, this COVID is obviously a bad situation, but it has made things easier for the patients in many different ways. Not saying that it's because of the COVID it has happened, but it should have happened before. But anything is better in this situation, right? Organizing the tests. Before that, calling the patient back later with some further advice. Let's suppose if you come across a question which you cannot answer in the consultation, and you tell the patient that, look, Mr. Smith, at this moment of time, it's very difficult for me to answer your question. Let me speak to my seniors and get back to you with another 15 minutes, 20 minutes, or I'll give you a call back as soon as I have some more knowledge about it. So you have to tell them, when are you going to call them back? You're going to call them back today, you're going to call them back tomorrow, because they'll be waiting for your call, because they have asked you a question and you have some unfinished business with them. Okay. Now, organizing the tests. Okay. So when you are thinking about organizing tests, as I have told before as well, in scenarios like this, if the patient cannot come to the hospital for giving, let's suppose, giving their bloods or giving their any biopsy, giving or collecting any information, you always can tell them that, is it okay for them to go to the nearby GP where they can give their blood, and from there you can collect. Okay. Obviously, sending in a phlebotomist is also an option, but obviously due to COVID, that option is actually blocked these days. So never go till the phlebotomist at this situation, but always remember that can be one of the options when you're working in the hospital later on. Now, safety netting. So as much as important ICE is in a telephonic conversation, safety netting is the most important thing as well. If the patient is having pericarditis, but you still have to give him an MI safety netting, you cannot miss it.
Okay, because we know it, we cannot miss it because it's an MI, patient can die. So in scenarios like this, you always have to be very clear in safety netting. Okay, and you have to give a very good safety netting. So after you have done your management plan, you have done a good planning, you have to make sure that, okay, these are the things that you should be looking for, and any of these occur, immediately rush into your GP or come to see us immediately in the A&E. If you cannot come yourself, do call 999 and get in an ambulance. So make it very clear to them that what are the red flag signs they should be looking for in the situations. Okay, now when you're asking them, let's suppose if in a station, if the patient tells you, doctor, I have called you today because my wife has asked me to call you. My wife thinks I'm crazy, but I don't think so. Now, in scenarios like this, you have not come to a conclusion because over a telephone, you cannot tell the patient is having any mental disorder or not. So how you can proceed in scenarios like this, where you are not only dealing with the patient, but you're also dealing with the patient's wife, who is obviously an indirect connection. So you can tell them, how about Mr. Smith, whatever we have discussed, you discuss all of these with your partner. And if you guys have any other questions, we can make a further appointment so that we can address both of your concerns together. So this shows that you are not only concerned about the patient who has called you, but you are also concerned about his wife, who basically asked the patient to call you. So wife was concerned, but you are not talking to the wife, you're talking to the patient directly. But still, you have to keep the wife in the picture. So it makes your consultation very easy. Also, it makes it very good as well, because you have doing a wholesome situation. You're bringing in the patient, you're asking them to discuss it with their partner, and you're offering them another appointment where you can address both of the concerns together. Makes it very good. Okay. All right. So the next one. So this was about management. Obviously, consider referral. Whenever there is a red flag and you know that this patient might be in a very dangerous situation, you have to consider a referral. If you're in a GP clinic, you can't ask them to come here because you might not have a CT, you might not have obviously you don't have a CT, you don't have an MRI. You have to refer them to the hospital or the A&E. So that becomes very important as well.
Thank you for watching. Stay tuned for more videos. See you guys next time.